Hello, everybody. My name is Erik Bleich, and I am a professor of political science at Middlebury College and the Executive Committee Chair of the Council for European Studies. I want to welcome you to this webinar. This is the first in a series of CES Insights webinars that are designed to cover topics of pressing concern in contemporary Europe. And today's topic is one of the most pressing in contemporary Europe, COVID-19 in a global Europe. I'm going to introduce Jason Beckfield, who will be our moderator for today's discussion. Jason is a longstanding CES member, and he co-chairs the Health and Wellbeing Research Network. He's a professor of sociology and the chair of the Department of Sociology and associate director of the Center for Population and Development Studies at Harvard University. His research focuses on the connections between political institutions and social inequalities. His book, Political Sociology and the People's Health, was published in 2018, and another book, Unequal Europe, Regional Integration and the Rise of European Inequality, was published in 2019. Jason teaches courses on social inequality, population health, globalization, and quantitative research methods. So we're very happy to have him here today moderating this discussion, and I thank him personally very much. Jason is going to introduce our panelists in a moment. Then he's going to moderate the discussion for about 40 minutes. If you have questions, go ahead and put them in the Q&A box you should see at the bottom of your Zoom interface, and I will collect and assemble those questions. I'll introduce them during the final 15 minutes or so of our discussion, so there's a chance for the panelists to respond to your questions. We're going to go for 1 hour in total, and with that, I'm going to hand over the digital reins to Jason.
Thank you very much, Erik. And thank you, I should say, for having the idea to do this series of webinars. I think this is an exciting initiative on the part of the CES. And I'm obviously delighted to have this chance to moderate a discussion among a really distinguished panel of experts on what is, without question, the problem of the day. And so, people might be wondering, why exactly are the social scientists, who are the predominant figures within CES in terms of disciplines, political scientists, IR people, historians, sociologists, talking about COVID-19, and what might we have to say about it? And I think there are actually several reasons I want to highlight before introducing our distinguished panel. And the fundamental thing, I think, is that there's quite a lot of research from epidemiology, social epidemiology, population health science in general that shows convincingly that health, illness, healing, and death are all highly dependent on social structure. And this has been framed in various kinds of ways. One of the framings I really like is from Michel Lamont and Peter Hall, whose Successful Societies project framed this as a question of population health being a way to evaluate the success of society, which I think is a helpful way of thinking about it. Another way of thinking about it is that the distribution of health is really all about the distribution of power. And I think you'll hear that theme touched on by the panelists in just a moment. One of the interesting things I always find when I teach this topic at Harvard is I ask the students on day one what they think the most important determinants of population health are, right? And they give the usual suspects: genetics, healthcare, diet, exercise, that kind of stuff. I asked them the question again at the end of the semester, and the answers are really very different, because along the way, what they have discovered in many cases is that the social determinants of health, the way we live our everyday lives, the policy environment we're in, the inequities that we live every day. These are the things that really have the most profound effect on health. It's always complicated to talk about percentages, but kind of a crude estimate is these social determinants account for between 70 and 80% of the variation in population health. So with that framework out there, I want to introduce our panelists, and I'm absolutely thrilled that we have a global group here from many time zones. We have Sanjoy Bhattacharya of the University of York, where he directs the History Department's Center for Global Health Histories. He's also a professor in the history of medicine and a Wellcome Trust senior investigator. He's head currently of the WHO Collaborating Center for Global Health Histories. And as many of us know, he specializes in the health, medical, environmental, political, and social history of 19th and 20th century South Asia, as well as the history and contemporary workings of international and global health programs around the world. So welcome, Sanjoy. Thank you for joining us.
Thank you.
We also have Julia Lynch of the University of Pennsylvania. Julie is Associate Professor of Political Science. She is also a longtime CES stalwart leader. She's a former member of the Executive Committee. She also served as the treasurer of the CES and also chaired the local organizing committee of the CES for the Philadelphia meeting. There's a WHO connection between Sanjoy and Julia, which is that Julia is an expert advisor to the WHO's regional office. Something that is very important that everyone know about Julia is that she has a new book, which is called Regimes of Inequality, the Political Economy of Health and Wealth, which is clearly directly relevant to what we're talking about today. I want to note that she very provocatively argues in this book that inequality persists because political leaders choose to frame the issue of inequality in ways that make it harder to solve, using debates around health inequities. So super interesting stuff. Welcome, Julie. We also have Sangbum Shin of Yonsei University, where it is 10 o'clock at night. So thank you for staying up late for us. Sangbum is a professor of international relations. He took his PhD in 2004 in political science at Indiana University. As a fellow Indiana alumni, I have to say go Big Red. And he studies global health from an international relations perspective, and has quite a lot of expertise in China, Japan, and South Korea. Sangbum, welcome.
Thank you.
All right, so I want to get the conversation started by asking all of you to tell us how you see the current state of affairs when it comes to varying national responses to the pandemic. And I think it makes sense to start with Sangbum Shin. And I would love to hear from you how you see the varying responses of China, South Korea, and Japan to the pandemic.
Right. Yeah. Yeah. As a scholar of international relations, I can say that there are two different ways to look at this phenomenon. Number one is in terms of the role of the international regimes. We can approach this. The other way around is to focus on the national responses. In this case this is predominantly the national responses. China, South Korea, Japan, they responded very differently, and then the difference can be explained by domestic factors. There are a lot of different factors like political regime, democracy or authoritarianism, or even political culture. But I would say at this moment, that could be, the key point could be the role of the leadership and the trust on the government, especially in South Korea. Because there are a lot of variations even within the democracies. And in China, in Japan, we still lack of information, so we are not really sure what's happening there. So I can just focus on, if I just focus on Korea, it's pretty much about the trust on the government. The people trust the government, so they followed the direction of the government, and the government's policy was about trace, and then they figure out the patients and then test them and then isolated them. they did it very systematically, but without cooperation of the people, it would not be possible. And even in some recent cases, there were some outbreaks in some areas of where some sexual minorities and some illegal migrant workers are going, just nightclubs. But interestingly, people are really tolerant about the minority issues in this case of, crisis. Before this, Korean society is not really benign to those minorities, but at this moment, it's interestingly, they are really accepting those people. So I think that's also related to the trust in the government.
I'm curious if you could say a little bit more about that. The ways in which trust in government is connected toward, is connected with a more benign bearing toward different minority groups.
Oh, the most recent outbreak happened right after that. The government announced officially that even illegal workers, we can test you and we will not kick you out. So never mind and just come to the test. So I will guarantee it. And then also to those sexual minorities, government responded that we will not open any of the personal information to you. So we will guarantee it. So the government action was really important. And then all those people trust the government and they cooperated. So that's the case.
Yeah, I'm curious if you could say a little bit about how the government, especially in South Korea, established its credibility in this domain. Yeah,
I think that's the I can say the difference between the 2015 case of the MERS, the Middle East Respiratory Syndrome. At that time, the regime was more conservative, and then now the president and the incumbent party is more liberal and the leftist party. And then there are some things like learning effect from the 2015 case. But at the 2015, the government did not open any information about the location of the hospitals where the patients were located. So that made really a big mistake. And then people really did not trust the government and they did not cooperate. But at this moment, people really trust the government because of their support, general support to the incumbent party and the government. And in the middle of this crisis, we had the general election in April 15. The incumbent party win the landslide, like it's a historical victory. And the president's approval rate is like 70% now. So I think that's pretty much a political support in that context.
No, super interesting. Let's turn to Europe now. Julie, if you could tell us a little bit about how European states varied in their responses. I think it's fair to say there's been at least as much variation on the European scene as there's been among China and Japan and South Korea. Julie, you're muted.
You'd think in all of the webinars that I've done in the last 8 weeks, I'd learned to unmute myself.
We're all learning, man.
Yeah. So, I think when most people think about the variation in government response to the COVID-19 crisis, they're generally thinking about two things. So what kinds of restrictions governments have imposed on social life, through stay-at-home orders or restrictions on social gatherings or on mobility. Or they're thinking about testing and contact tracing and potentially quarantine, as Sangbum just talked about. But I think it's really important to highlight that there are actually two other areas of government response that are really important and that also vary quite broadly across countries. So we also need to be thinking about what's going on in the medical care system. So people who are afflicted by COVID-19, and also people who aren't, but who have other conditions, which are also potentially lethal, continue to need to interact with healthcare systems during this time of very great strain. And so what government responses have been put in place to shore up medical care systems and also to ensure that people have access to medical care during the crisis, there's been quite a lot of variation in that. And then also there's been a lot of variation in the economic interventions that support people's ability to stay home during the crisis, not spread the virus by going to work or, having their children in daycare or whatever. So, and keeping businesses operating. So I think there are really 4 things, not 2, that we need to be paying attention to when we think about variation in government response. So the restrictions on social life and the testing and contact tracing and quarantine, yes, those are 2, but then also the medical care and the economic interventions. And on all of those dimensions, there's actually quite a lot of variation across European countries. I don't have time now to go into the detail, but just in terms of thinking a little bit about where that variation might come from, anticipating the question that you asked, Sangbum, I think we can explain a lot of the variation in the medical care and economic interventions, not all of it, but a lot of it through, the same kinds of schematics and variables that we would bring to bear on any comparative political economy problem. What's a little more challenging is to try to understand the variation in the restrictions on social life and on the testing and contact tracing. That's a little more idiosyncratic. And so I think we're going to be looking to things like government partisanship or the interaction between government partisanship and sort of traditional models of comparative political economy, but also to things like trust in government. So I think we need to be thinking about different categories of explanatory variables to try to understand the different parts of the government response. This is not going to be a straightforward kind of one variable master key explains everything. And so, yeah, and there are lots and lots of inferential problems, which I can get into later in terms of thinking about, how do we want to model the explanatory power of some of these variables? But I think, just to start out the conversation by saying, yes, there's a lot of variation across governments in Europe in terms of what they've been doing. It's not clear how the variation in the policy response is related to variations in mortality or incidence of the disease, in part because we still don't have very good data. But there's also a lot of variation in the mortality and the incidence.
Can you say a little bit about that variation in mortality? And I think there's a debate out there, clearly about the value of different kinds of data, right? Do we believe the excess mortality data more? Do we believe testing, case data in some countries but not in others more? How do you see the big picture in terms of which countries are faring best, which worst in Europe?
Well, so I think, a lot of our understanding of who's faring best and who's faring worst have to do with our expectations. So, how are they faring compared to other similar countries, I think is a reasonable question to ask. So I'm gonna share my screen for a second, and I'm gonna allow you to see a slide. So I prefer excess mortality data. I don't think the other data that we're getting right now are really worth much.
Can you say why?
Because there are such dramatic cross-national and sometimes even subnational differences in how deaths are measured, to what they're attributed, and also in sort of the extent to which testing had been rolled out at various times. So in terms of the deaths data, they're just, this is always true, by the way. This isn't just a COVID-19 thing. There are always huge cross-national and within country differences in how deaths are recorded that make it very hard to figure out how to attribute deaths. But then there's also the question of what kinds of deaths should we be attributing to COVID-19? And I prefer the excess mortality data because it really makes the point that there are a lot of people who are dying now of things that aren't the COVID virus, but that are still deaths that are caused by the pandemic because people are delaying accessing needed care, or they're unable to get care in a timely manner. So what I wanted to show you, can you see my screen of the Nordics here?
Yes.
Okay, so if you look, so the height of the solid blue line is basically the amount, it's the standardized amount of excess mortality that's been experienced at various weeks. And we're in the tail end of the yellow zone now. The yellow zone just means that the deaths the excess mortality is estimated at this point. But you can see that there's a much higher level of excess mortality in Sweden as compared to Norway, Finland, and Denmark, right? And so everybody's talking about Sweden. Everybody wants to understand what is driving this difference between Sweden and the other countries. But if you look at Sweden compared to some of the other countries in Europe that have experienced very high mortality, England, Spain, Italy, I think Italy was very much in the news. Sweden's death rate doesn't look so bad. And really what looks horrible is England. It's not the UK, it's actually England. And it looks really bad in England. The peak is very high and it's been very slow to fall. So, this goes to my point about what are our expectations, how we choose to explain this variation. If we look at, the first graph that I showed you where Sweden looks to be really, really high, then we start to think about, well, the Swedish government's strategy of, not mandating stay at home, or maybe it's the Swedish government strategy of not communicating clearly with ethnic minorities who also happen to work in nursing homes, which is where most of the people in Sweden are dying, right? Like we can tell a number of stories about what might be driving this really high bump in Sweden, but then, looking sort of continent-wide, I think you have to ask whether those are really the right variables to be focusing on when you've got other countries that are clearly having a much more serious difficulty. So anyway, that's just to throw a little bit of data on it to illustrate the kinds of ways that I'm starting to think about this stuff.
That's great, Julie, and super helpful to have some data to chew on. Since you raised the issue of England, that certainly tees up Sanjoy in a great way. So Sanjoy, I'm very curious to hear how you're thinking about the situation in the UK, especially for Black and minority ethnic groups, which is a domain where I know you have a lot of expertise.
So thanks for the invitation. Delighted to be here. And thanks, Julia, for offering me a path into my presentation. Very collegiate. I'm grateful. Julia makes a very important point. I mean, the way UK administration works is that you have 4 nations, and administration in health is devolved to an extent. In the sense that London still has a huge amount of economic clout, has a lot of redistributive powers when it comes to the distribution of procured materials that are necessary to deal with COVID. And yet the devolved administrations have their own NHS budgets and have their own public health budgets, which means that they can, especially in relation to Scotland, where you have an opposition party in power, develop very specific health responses. And Scotland really has been the more effective response, in a sense, within the UK than England's response has been. And that's because I think the value the Scottish government gives to testing, tracing, and quarantining. Isolating. There's also the issue of public health messaging. Trust is one thing, but there is also, I think, an important issue to be considered about the quality and consistency of messaging. And when you look at it from that perspective, then Scotland again comes out as a much more effective actor than I would say the English agencies involved in communicating the dangers, advising us how to behave, And therefore, trust develops as a result of that consistency as well, because as I'm sure all of you have been aware, we've been wrapped up with this case where the British Prime Minister's most important advisor broke the rules himself that the government had set about us staying home, and drove more than 200 miles north. And he gave his reasons, but which don't make sense to me personally, but he gave his reasons, which were then sort of justified by his supporters in government. Now, being based in the north of England, since the day the news broke and was justified by government rather than an apology, I see many more people in the parks in northern England, in York, where I live. Basically, Public Health England messaging is now taken less seriously because of that one act of where the elite, a member of the political elite, is seen to have broken the rules. So Scotland, on the other hand, was much stricter. When a senior official in Scotland was found to have visited her second home, which was disallowed under the rule set by of staying at home by Public Health Scotland, she was forced to resign. So I think Scottish societal responses to such consistent messaging has helped, whereas in England, where there have been political inconsistencies and messages about it's not stay at home anymore, it's about staying alert. Mixed messaging like that seems to have confused perspectives. Now, you raise the issue of, what we call BAME, Black, Asian, Middle Eastern populations. Often what public health authorities in the UK ignore is that, yes, a lot of BAME ethnic minority populations are comfortable with the English language, but some of the older members of these ethnic minorities are actually more comfortable with a range of other languages. And as far as Public Health England's messaging goes, I am unsure if they're really messaging in the multiplicity of languages that are often used by ethnic minority populations in England. So that I see as a weakness. And I think this has a wider public health issue attached to it. Is the state even listening to the sort of social media-based messaging that's happening about COVID, or any issue, important issue, like vaccine hesitancy in multiple languages? Because unless you listen to the messaging that is being communicated within very specific communities, how can you ever prepare? How can you ever counter? And I've been speaking to a lot of colleagues who work with ethnic minority organizations across the country, and they've all been flagging up to me the very large amounts of misinformation about COVID that has been going around in WhatsApp circles. But I do not see any organized official policy towards studying and then responding to such misinformation about, the fact that the virus is not as dangerous, perhaps, as the state is presenting it to be. And this then comes back to the issue of trust that the other co-presenters have also raised. So does that answer your question?
It does. No, that's very, very helpful. I'm curious if you could maybe give us a window into the differences between the English government's response and the Scottish government's response. What are the factors that you think accounts for the different ways in which they're responding? Why is it that the Scotland government, for instance, is enforcing its own rules, on its own elites in a consistent way?
Well, this is me, I think, also presenting to you my own political preferences here. I mean, I think the leader at the top matters, and in Scottish administration, I think Nicola Sturgeon has been absolutely fantastic. But like Jacinda in New Zealand, it's the same message, clearly explained, which clearly Nicola Sturgeon herself follows. This leaves an impact. On the other hand, in England, we have Boris Johnson, who, whilst telling us to be careful, went on to national TV in one of his daily briefings and announced to everyone who was listening in, I was one of the people listening in that day, saying that he had shaken hands with everyone in a hospital he had visited, including some COVID patients. And not soon afterwards, he came down with COVID himself, and then he disappeared from sort of the public eye for 3 weeks. But whilst he disappeared from the public eye for 3 weeks, his administration seemed to be flailing around in terms of strategy, in terms of messaging. So it was an almighty mess. So at that point, people were quite forgiving about Boris Johnson not being there to lead. He sort of gave some power to his de facto deputy Dominic Raab, but Dominic Raab didn't sort of take on a sort of leadership role per se. He almost as if he wanted to avert risk. His messaging was always that he was just standing in, and that he was trying to do his best in a very difficult situation when the country's prime minister was out of action. Whereas I think the difference in the Scottish response has been that Nicola Sturgeon has been there, she has been in charge, her messaging has been online, and I think people just trust her more because she clearly follows the advice she gives people. And that has been the biggest problem in relation to England, as far as I'm aware, not just speaking to ethnic minority organizations and people who work with ethnic minority organizations in multiple languages, but also the general public. I mean, ever since the news of the advisors breaking the rules broke, I see a sudden political bipartisanship in this anger that has developed, because so many people have lost people they've known in England, and they made sacrifices, but not by not going to funerals, not visiting families. And suddenly people think there's one rule for the political elite and one rule for the rest of us who've made these sacrifices. And I feel very strongly about it myself, having lost my maternal uncle in London to COVID-19, that I would have loved to have been in London to give emotional support to my aunt who was in pieces, but I couldn't because I was following the rules. And yet it seems to me that some members of the political elite who'd made these rules thought they didn't have to follow the rules. So coming back to trust, I think very different leaderships. Sturgeon is seen to be strong, but also empathetic. Boris Johnson seemed to be careless and slightly confused from my perspective.
Thank you. One of the and let me just say, my condolences to your family for the loss of your uncle. And I think in this time, so many of us are grappling with this, this very difficult new way of mourning loved ones, and that has an array of personal impacts. Clearly, it also has an array of potential political impacts. As the population is full of voters who have more and more personal experience with loss, and one of the things that seems really interesting now is the ways in which different governments are going about attributing blame to different kinds of actors, and avoiding blame themselves, which suggests that this kind of rage people feel is a powerful political resource that could be used by political actors. I mean, so I would love to hear, from each of you, which where you see this going politically. Which political actors do you feel are kind of best positioned to leverage this as a resource?
Can I
jump
go?
in there. Oh, sorry.
Oh no, it's okay. Just go ahead.
So I was going to say that I think there's something quite indeterminate about that. So in the UK situation, I think, you know, populists in the UK have a point, right? There really is one rule for the elites and one rule for everybody else. And, you know, under the Johnson administration, I think that's, you know, that's been really clear. But there's sort of a, you know, there's a brewing populist discontent that has been there, you know, for a long time. And in response to, you know, 30 years of partisan convergence around neoliberal economic agendas, right? In other places, I think, and this is true more in England than it is in Scotland, in other places, I think there's much more potential for, you know, what we might, from our own elitist perch, call more responsible parties to really harness a sense of societal mourning and grieving to more productive purposes, to, you know, sort of a more kind of post-war, we're all in it together kind of rebuilding strategy. So I would be very hesitant to say that I think, you know, broadly speaking, populist parties are going to benefit from this, or broadly speaking, even that incumbent parties are going to benefit from this. Although we have seen globally that has tended to be the case so far, I don't know that that's going to continue. So I would like to make a plea for a little more indeterminacy in how we understand the politics of this situation.
Very, very good point. Before turning to Sangbum, who also wants to get in on this point, I just want to push you a little bit, Julie. So apart from you know, kumbaya, we're all in this together, you know, we can do it. What are the other ways in which you would see responsible, pragmatic parties as able to push this issue?
Well, I think in places where there is a capacity for a policy response that is a truly generous policy response that can bring society together in a way that it hasn't been in recent years, I think there's some hope. So I think, you know, the German government, for example, not only in Germany, but it's one example that comes to mind, you know, they put into place pretty proactive measures to support families who had lost jobs, who had lost income, to support people who needed help with childcare once childcare centers and schools were closed. So that's where that sort of fourth category of government response comes in, right? If you can build on social policies, labor market policies, to make them more fair and more supportive than they've been in the past as a responsible party, you know, whether of the center left or of the center right, I think you really do have this is an opening. You know, I think political sociologists will look back on this as a critical juncture, right? This is a moment when many things are possible. And not everything is possible. If you don't have a functioning social welfare state or functioning labor market policies to build on, it's going to be very, very hard to do that. But if you do, and you're a governing party, you have the opportunity to put in place pretty proactive measures that can help people weather this storm and that can help your society and your economy recover more quickly. And if you look at the contrast between what's happening in England and the US as compared to pretty much every other OECD country, and now also, you know, many sub-Saharan African countries look to be doing much better than either the US or England in their response. You know, I think it's pretty clear that there are options, that governments do have options in how to respond to this.
Thanks, Julie.
Yep.
Sangbum.
Yeah, in Korean politics, there's always divide between the more conservative party and more leftist party. And the conservative party's strong argument is that the leftist party is too much pro-China and then less on US side, but that's not actually true. Those are all same. But in this crisis, they strongly argued from the beginning, this is all about China, this is all because of the China, and then this is all because of the government who did not block Chinese people from coming in. Later on, the government blocked Chinese people only from Wuhan, but they did not block all those Chinese people. So they kept opening those boundaries, the national boundary. And then when this crisis calmed down, the conservative argument on China bashing, they lost ground. So I think this is really it's gonna be a big change. Before this, they always criticized the government that, for example, the air pollution from China. And then they always criticize that the current government is very weak because they are pro-China. So they are not really working on the air pollution issue because they're not strongly arguing for China about this. So that worked very well in the society and in the media. But this is, I think, is an unintended consequence. But those China bashing argument is not really working anymore. So I think it's could be a benefit for the incumbent party, but still, as Julian, some of you mentioned, we are not sure how long it will continue to do this. So that's my point.
Thank you. Sanjoy.
So I'm going to start off with a slightly controversial statement, and often in discussions, usually within the UK, but also sometimes within closed-door meetings in the World Health Organization, I make the point that as someone who's British but of color, ethnic minority origin, I have consistently found it easier to deal with the outright racists than the liberal racism that I sometimes encounter. So why do I make that point? I think it's important to remember that ethnic minority populations in the UK are not necessarily left-leaning. They're not necessarily Labour voting. For a variety of reasons, you have certain sections of the UK ethnic minorities. They justify it through feelings of aspiration, but there are also religious relations that are often not identified or discussed by sort of more majoritarian Anglo-centric analysts in this country, that you have very large sections of the ethnic minority population voting conservative. And I think that's true in the US as well. Why do I point this out? Because it is important to remember that groups of the British ethnic minority population actually voted for Brexit. We should not ignore the fact that the Labour vote was splintered as a result in the last national elections. You had large groups of white working class populations also voting Brexit. So we have to look at the COVID response in relation to Brexit. Sangbum talks about China bashing. Europe bashing is part of the course here. So,
and the US does both. We have both.
The US does.
Sorry.
Yes. So whenever things get too difficult in relation to explaining the problem in relation to COVID response to England, there is also an enemy that can be bashed for distraction purposes, and that's the European Union. The point, though, is that this government seems to be coming under pressure from a cross-section of the press, including right of center press that had supported it 100% during the Brexit, before the Brexit vote and after the referendum was won by the Brexiteers. What you can see is growing criticisms, for instance, of the government not signing up to European procurement schemes for personal protection equipment or ventilators, and through this criticism, another view of Europe also coming out, That is, Europe can work in solidarity. Europe can do things together. And it has, I would not be surprised if I read this in the Guardian newspaper, which is left of center. But what has surprised me is to read articles like that in the Daily Mail, for instance, which has been very pro-Brexit. So I think what this COVID-19 crisis and pandemic response, more importantly, is doing is that people are beginning to raise questions about some of the populist claims, about everything about Europe being bad, or indeed the death in the care homes, where a very large number of elderly people have died. And again, this is a demographic that had been quite pro-Brexit and quite pro-conservative. So questions are now being asked about the competencies of the so-called populist sort of Democrats, because they presented themselves as Democrats who were going to, to use US terminology, drain the swamp in this country and make government more responsive. And yet, what this pandemic response has shown is that they haven't made government more responsive. They seem to display other forms of elitism, like feudalism almost, where there's a complete disregard, there's a complete lack of respect towards the working man and woman in this country, no matter what their race. So my sense is that this very botched pandemic response, and especially this failure by our Prime Minister to sack his primary advisor, who has clearly broken the regulations that were explained to the rest of us so clearly, is going to inflict a political price on the conservatives, and especially those who wanted to represent a more sort of democratic populism. And I have a feeling it will splinter the party, because those who have been claiming to represent the democratic sort of populist ideals will not want the power of that representation to be taken away from them by a public school, very Etonian, very elitist prime minister. So I have a feeling we will see parts of the Conservative Party turning against this sort of very, sort of rich clique that seems to rule this country. I'm not saying that we'll necessarily have a sort of democratic populist as a prime minister, but they might sort of even splinter the ruling elite and then reassure someone who's willing to stick the head over the parapet that there'll be wider political support for the party should they want to replace Boris Johnson as prime minister. So this is the sense I'm getting. I'm also hoping that, the fact that so many Black and Asian and Middle Eastern doctors and nurses have died in this crisis, one can only hope that the benefit of that sacrifice is better race relations. Mm. But that's been, every time I hear another Asian or Middle Eastern or Muslim doctor, especially, this is particularly the case in relation to Muslim nurses and doctors who, have been under attack by this right-wing press for a very long time. I always hope that this will create a better understanding of how British they are. Losing your life, sacrificing your life is the ultimate sacrifice for the national good, if you have to see it in those terms. But then again, the right-wing, extreme right-wing fringe will always remain and they will always hate. But I'm hoping that this pandemic response creates greater space for understanding and a greater space to defend ethnic minority professionals within the health system who are taking enormous risks, even now as we speak, in protecting society, making sure that our efforts to flatten the curve do work by taking care of severely ill people in very dangerous conditions. The supply of personal protective equipment is still insufficient. So one can only hope. But, you know, racism in politics is a terrible thing, as all of us, I'm sure, know. And such sacrifices are sometimes easily forgotten.
No, thank you. Thank you. That's super interesting comments. And I think one of the things that they reveal is the many ways in which the pandemic is putting into the foreground questions of political cleavages, you know, political entrepreneurs, political frames, right? Erik, I think I saw your hand up. Do we have some inquiries from the audience?
We do. We have quite a few. So I'm going to try to summarize them briefly in a couple of different categories, and then let you, Jason, kind of direct who might want to answer what, or people can respond as they would like. We have a question from Roman Graf about the importance of timing in responses. So does it matter if you moved first, second, last, did this, did that at different time points? We have questions related to a theme of minorities and freedoms. So questions about variability in treating migrant communities, minority communities, vulnerable minority communities in European countries. And also questions about the trade-offs between freedoms and rights restrictions, particularly with reference to vulnerable minorities. We have a question about leadership. In response to Sanjoy's contrast between the English and Scottish leaderships. Is there a difference in is there any visible difference in the willingness of people to follow if their leaders are doing a good job versus a bad job? We have a number of questions about cross-national differences. So thinking a little bit more broadly, in particular about Central and East European countries. And this links back to the questions on restrictions on freedom that are quite strong in those countries now. There's a question about Canada's response, sub-Saharan African responses. So an invitation, I think, to look more broadly. And then a link to a question about global trust. So does it matter if you trust the WHO or global institutions as opposed to your local leaders? And then finally, a question about the politicization of health reactions. So I think taking up the notion that in some countries, particularly in the United States, it's become a political statement to choose to wear a mask, keep distance, wash hands, or reject those things. And a question about whether there's a historical precedent for that. And if so, how was that dealt with and overcome? So that's quite a broad range of questions.
No, it's a lot of great questions. So, you know, thank you to the audience for posing those, and thanks to Erik for forming them into a coherent package. I want to turn to Sangbum. I think just given that you know, you have a lot of expertise, I think, in the question of the importance of timing in the responses, but also in the role of trust, you know, and its connections to leadership. So. What do you think?
Well, in a given time constraint, I'll focus on the global trust. In 2002, SARS virus outbreak made a big crisis in China and in the global world. After that, WHO made an attempt to revise their regulations. And then after that, in 2005, they finished the revision process, and the birth of the international health regulation was created. And that was really a big accomplishment, I guess. In this crisis, after this crisis over, we can expect that kind of historical momentum of the development of the WTO or not. Personally, I'm not really positive about that, but the global trust depends first on those role of the international regimes such as WTO. The second one is the superpowers. And this side too is a little bit more pessimistic than before because two global superpowers like China and United States do not look like they will play a big role for cooperating and to making a global trust. So multilateralism and a liberal order in the post-COVID period, I think it's a little bit more pessimistic, and then like more individual countries that they have to do all these things all by themselves. I think that's my personal prospect.
Thank you. Julie, I wonder if you could pick it up and maybe start by commenting on the politicization of health reactions. I think you have a lot to say about politicization of health.
Yeah, so I mean, one of the things that I think has really characterized the US response, which Jonathan Rodden has helpfully been pointing out, is that in the US, up until the last couple of weeks, there was a really strong overlap between the geographic basis of partisanship and the geographic basis of the disease. So essentially what happened is that blue places were hit much harder by the pandemic than red places. And
sooner.
so, what's that?
And sooner on the timing point.
Right,
For our
exactly.
international guests, blue and red.
What's that?
Blue and red.
Blue would be sort of Democratic, progressive leaning, and red would be Republican, conservative leaning. And, you know, the more rural, less densely populated areas in the US, sort of population density is very, very highly correlated with voting for the Democratic Party. So these more rural, less dense areas were initially hit much less hard by the pandemic, although they've started to be hit now. So very early on, there was a very solid basis for politicization of the cleavage around. There was an overlap between who was getting affected by the disease and partisanship. I think what you see in Europe is that that's a much less clear pattern, in part because population density and patterns of mobility really were strongly related to the initial impact of the pandemic. And those things are much less strongly correlated with partisanship in most European countries than they are in the US. So I think in the US, you had conditions, and again, this is sort of Jonathan Rodden's work, it's not mine, but I think he explains very clearly how in the US, the conditions existed for a politicization of some of these health behavioral responses. So I'm not gonna wear masks, I'm not gonna stay home, I'm gonna take my guns to the State House and I'm gonna protest stay-at-home orders, happening in areas that weren't strongly affected by the disease. Now all that is changing. So more rural areas in the US right now are being hit actually much harder. Initially, the core of the affected population has been groups like meatpacking workers and inmates and people who work in jails and prisons. But as soon as these states reopen their schools in early August, those kids, the kids of meatpacking workers and correctional facility workers are going to be back in school. They're going to be spreading the disease to each other and to their teachers. And so I think it's really an open question what's going to happen. And overall, what we've seen in the US is despite some really highly politicized and highly publicized responses of the I'm not wearing masks, masks are for sissies kind of variety, in fact, there's overwhelming agreement among the population, something like 70 to 80% of people, regardless of their partisanship, believe that it's a good idea to wear masks and that it's not a good idea to open the economy. So I don't want to overstate the effect to which this stuff has been politicized, but I think it has been to a certain extent in the US, but we haven't necessarily seen that happening in other places.
Thank you, Julie. Sanjoy, last word? You're muted.
Sorry. Yeah, so, you know, I believe that the WHO is important. The WHO is important because it creates bridges, diplomatic bridges. It opens diplomatic channels. What has struck me is that both in the US, you know, federal leadership in the US and sort of central government in the UK, when it's criticized the WHO or ignored what the WHO has advised, it's done so with one eye on its local politics. And then when their decisions have sort of rebounded spectacularly, they've tried to then shift blame to WHO, often as a historian, I'm struck by creating alternative historical narratives about what they'd done in the past. But I do think this then places a challenge on the WHO itself to become even more transparent, because I was shocked last week when I was assessing a report on face coverings, the importance of face coverings for the WHO. And I found out there was a special COVID-19 social science support group for the WHO, which I had been unaware of, that had worked with certain academics to develop this report, which is still not out. When I looked at the membership of this, the vast majority of the membership of this advisory group, which is supposed to advise the WHO during this crisis, comes from the PAHO region and the Euro region. The Eastern Mediterranean region, which serves the Middle East and North Africa, is not even represented by one academic. And yet we, as social scientists, are very aware of the fact, that humanities scholars are very aware of the fact that that context matters. And yet, in formal structures, there is no advice being given about political, social, economic, or cultural context. So I think, yes, the WHO is under a political attack, but the WHO needs to do better to prevent those attacks in the first place by saying that they're really much more open. And the WHO is not just the headquarters in Geneva. The WHO, as Julia will agree, is the regional offices, and PAHO particularly has always retained a very independent sort of position on all matters policy in relation to what WHO does, including taking money from funders that the HQ would never take money from, linked to tobacco. So it's fascinating. So as academics, as critical analysts, we must look at the WHO in much more complex forms in order to critically engage with what it says and better understand how governments will try to attack the WHO. When Trump says WHO is equal to Tedros, that's just factually incorrect, because WHO is also Washington, DC. So, so I think the lawyers need to point out these difficulties. So that's one point. In terms of other politicization, one of the questions refers to migrant groups. And in all this, when we talk about Europe, because this is a sort of European focus group, we mustn't forget the migrants who are stuck in these terrible camps across Europe in crowded situations at a time when they're not supposed to be crowding and be close to each other. And it's a reminder, I think, of the inequalities in society, which are also relevant to what Julia said, the ethnic minority populations, the sort of minority populations in any country where there are economic inequalities, mean that people cannot protect themselves, cannot effectively social distance themselves. So my last word would be that, whenever we consider these issues, we must remember those less fortunate than ourselves. We always do that in our written work. But I think to the audience online, we must remember that there are these people who are not formally European citizens, and yet suffering from the politics, the hateful politics that is creating populism. So, you can have a report on migrant health in Europe without any consideration of what is happening in North Africa or the Middle East, the wars, which also have European participation involved in it, what happened in Libya, for instance. So we cannot just talk about the migrant crisis as a purely European problem. It is also a problem in relation to what Europe does in other regions, and therefore all the more reason to go back to the other point that we have to see the WHO and its regions as equally Asian and African as it is European, and then see the interconnections, because there are interconnections.
Thank you. Let me, Jason, did you want to say a final quick word? We're a little over time, so I'm
sorry.
The quick word is just thank you to the panelists. That was wonderful.
Yeah, Jason, Sangbum, Julia, Sanjoy, this could not have been a better launch to the CES Insights series. Thank you so much. And for those of you who participated online, I'm sorry we didn't get a chance to answer all of your questions. We hope that you'll come back for the next one. We'll be having more of these on different topics, so stay tuned for the announcement about forthcoming CES webinars. Thank you very much.
Thank you.
Thank you. Thank you, everybody.
Bye, everybody.
Thanks, folks.
Bye.